Okay, now let us demonstrate on this mannequin, and you will see that I'm going to, of course, this whatever technique you're using, whether using the whether you're using the film holders, which of course they are preferred, the ring type that we have discussed earlier, or using the finger supported film, the angle bisynctic technique, or you're using even the disposable sensor holders. We're going to use this one because actually what you do here mostly is you're going to do it in your endodontic work. So this one, which is we have demonstrated earlier, we're going to use it for the for this purpose because we will assume that, let's say, the upper four is the tooth that we're going to do the slope technique. So you use your sensor or film, whatever you're using, and then you will take the radiograph the normal way that you will take it. You will ask your patient to bite on the film, okay, and then you're going to take the X-ray exactly the same way that we have done earlier. So this is the normal technique. In this technique, it will be a perfect picture, of course, but what happens, unfortunately, is, as we said, that we will have the superimposition of the two canals. So what we will do is that we will take the film out. We have taken this X-ray, the first one. We will use another film because we cannot expose the film twice, or sensor, and then you're going to put it the same way that you have done it before, with the file present, whatever present inside the patient's mouth. Okay? Then you will ask the patient to bite on the film. Okay. Now this is for the film positioning. It's the same. Patient positioning, film positioning is the same. What differs actually is where the X-ray is going to come from. Here I'm going to remove this because it will interfere with my work. And then this is the normal position, right? Which we have the superimposed structures. Now what we're going to do is that we will come from another direction and we're going to give it a plus, in a horizontal direction around 20 degrees. So we are coming here from the mesial side. So the X-ray is coming here from the mesial side. So what we would expect, since we came from the mesial side, okay, we have come from the mesial side, the image of this one, which is closer to us, in the next film after we see it, this will move towards the 5. So it will move distally. And the image of the of the palatal canal, which is far away from us, it will move more towards the canal. While if I reverse this, if I come from a distal direction, again, let's say 20 degrees, the reverse will happen. Okay? This, which will be far away, since I'm coming from this direction, it will move with me. Okay? I came from distal, so it will move distally. I will expect the image to be on closer to the 5, while this one will move closer to the canal. Okay? So it is always the images, the closer one will move against my movement, tube movement in this case, while the one which is far away from me will move with my movement. If I come from a mesial direction, the palatal canal will go mesially towards the canine. If I come from the distal direction, okay, the palatal canal will go distally, while the buccal canal will go in a mesial direction. Tube shift technique can be done in a horizontal manner. That is when you move the tube in horizontally, or mesially or distally. Okay? There are other cases in which that mostly used in locating horizontal bone fractures. You may move the cone in a vertical direction. Suppose you have a fractured central incisor, you want to a horizontal or vertical root fracture, then what you're going to do is you will put the film, and then you ask the patient to bite. Again, I'm not referring to any film positioning or stabilizing method. You may use the finger, you may use the disposable sensor holders, or you may use the other holders like the ring holder, for instance. So what you're going to do, I'll just rotate this so that you will see it from the side. As you know that we have, if you're going to do the mesial shift technique, this is the way, this is the correct way. You do your first film. Your second film, you're going to replace the film, put a new film. If you want to mesial shift, then you're going to go distally, or you're going to go, you're going to do distally, because here we're in the central incisor, you go either way. You come from a distal direction, or you come from a mesial direction. And the anterior teeth, if you want to see a fracture, then you may use the vertical tube shift technique. And this, you're going to come from top, that is increasing the vertical angulation, or you may come from down, that is decreasing the vertical angulation. Either way, you would expect that here actually we don't want to, we don't prefer to using the for root canal treatment, because you don't want to see the lemurs from up and down. We use this technique mostly in determining the horizontal root fracture. Vertical root fractures, again, we prefer using the mesial and distal, that is the horizontal tube shift, so that we can see the fracture from the especially thin fractures. I will demonstrate how to see fractures so that all of us will understand how it goes. Now, for fractures, longitudinal root fractures, these tend to hide beyond the, they have the tendency to hide, especially if they are very thin. So again, what we do, we will come from more than, this is, I'm assuming that the camera is the X-ray tube, so you will come from more than one direction, so that you will have a better look, trying to find the hidden vertical root fractures. Horizontal root fractures are more readily diagnosed or seen in the radiograph. However, I'm coming from up or down just to see the horizontal root fracture.